Initially founded as the University Training Center for Healthcare Professionals in 1989, the Pham Ngọc Thạch University of Medicine, or PNTU, has become one of Vietnam's leading academic institutions for the health sciences. Based in the metropolis of Ho Chi Minh City, the university has trained 5,630 medical graduates since its inception and has established 26 full-time classes for the region's healthcare providers. The university is strongly dedicated to improving healthcare access and strengthening clinical resources in both urban and rural Vietnam to serve our region and our community. The mission of PNTU is to educate and train the undergraduate, graduate, and postgraduate medical trainees for providing and improving the healthcare of the Ho Chi Minh City community, and eventually will become a prominent health sciences institution of the region and the country. The vision of PNTU is to establish international collaborative projects and selectively integrate achievement in education and sciences to become one of the leading health sciences institutions in the country. The university is currently led by Associate Professor Nguyễn Thanh Hiệp, MD, PhD, who has championed the importance of clinical simulation in medical education in Vietnam and imparted on countless graduates the importance of learning by doing and excellence through continuous practice.
Hello, my name is Nguyễn Thanh Hiệp. I am the Director of Faculty University of Medicine. Our university was established in 1989 and has been a reputable school of medicine in Vietnam. PNTU decided to establish a new clinical simulation center that controls to the highest standards, not only to support its competency-based curriculum, but also to enhance the quality of education and the competency of the PNTU learner. The construction for the new center was started in May 2017 and completed in April 2018. The school board of directors has chosen the name Center for Elaboration Competency and Innovation in Clinical Simulation, or we can call Cecics in last 2017. Now together with Dr. Nguyễn Ngọc Phương Thư, Director of the Cecics, welcome to our Clinical Simulation Center.
Welcome to our Clinical Simulation Center. With a total surface area of 16,200 square feet, this center is located on the top 3 floors of Building C, a 9-story building at our university. The governance structure of Cecics consists of a director, an associate director, and 3 division chiefs. As director of Cecics, Dr. Thu oversees the day-to-day operation of the center with the assistance of the associate director and 3 division chiefs. The staff of Cecics comprise of faculty members, technician, simulation specialist, supporting staff, and about 40 standardized patients. Our mission is to serve the educational mission of the PNTU in establishing an exciting, safe, and conducive environment for the education, training, and practice for learners at all levels. Cecics PNTU provides expertise, standardized and modern training methodology, and state-of-the-art educational tools and equipment to ensure the high quality of teaching and performance assessment. In collaboration with basic sciences and clinical departments, and the Office of Faculty Development of PNTU and other medical institutions, Cecics PNTU will conduct research in simulation-based medical education to enhance learners' clinical competency and the quality of patient care. And our vision statement implies that we will continue to advance its mission in supporting the successful implementation of the competency-based curriculum of PNTU. Cecics will collaborate with departments and offices of PNTU and other national and international medical institutions to conduct research in simulation-based medical education and will become one of the best institutes for clinical simulation in Southeast Asia. We have now reached the 8th floor. There are a total of 14 rooms on this floor, including 9 OSCE, 1 preparation, 1 assessor, 1 server, 1 administrative, and 1 executive boardroom. Cecics takes the lead to serve the educational mission of the PNTU and strives to achieve the vision in becoming one of the best institutes for clinical simulation in Southeast Asia. These mission and vision are clearly visible on our website and across the 3 floors of the Clinical Simulation Center. We are now going to show you the assessor's room, so please follow me this way. In this room, all computers are connected to the CAE Learning Space, a clinical simulation management platform, and are used by our assessors for formative and summative assessments of simulation activities. The assessors can observe the learners in the OSCE or exam rooms for their encounters with standardized patients, mannequins, or part task trainers. Next to the assessor room is the administrative and executive board region. The administrative region includes 3 subdivisions: education, technology, and administration. The executive boardroom is reserved for the director and the associate director. You'll see framed photos of many well-known medical educators, physicians, scientists, and Cecics founders or supporters as we walk towards the OSCE rooms. We have 9 OSCE rooms on this floor, and you'll see one of these rooms in just a moment. The outside laptop computers are for students, and the inside laptops are for standardized patients to input their observations. Both laptop computers are connected to the learning space. Each OSCE room is set up to resemble and closely mirror an examination room of our outpatient clinic. Our students come here to train with standardized patients, mannequins, or part task trainers to apply their medical knowledge and practice different skills, such as communication or history-taking skills, and to improve their clinical decision-making. All medications used in OSCE rooms are clearly labeled simulated medication and/or do not use for patient care, and all simulation equipments or instruments are labeled simulation equipment and/or do not use for patient care. Next to the OSCE room is the preparation room or the classroom with a maximum capacity of 40 people for pre-briefing and/or debriefing for learners, and staff development or meetings. With the CAE Learning Space system, we can replay sessions for review and discussion during the debriefing. Their server room housed the CAE Learning Space system on the 8th floor. We will now take a look at some other floors in our center. Here we are on the 7th floor. We have also 14 rooms on this floor, including 9 OSCE, 1 preparation, 1 sanitized patient, 1 storage, 1 debriefing, and 1 student's room. And this is the room for our sanitized patients. We have recruited a wonderful group of standardized patients. Some of those are public actors. They are employed on a part-time or hourly basis and trained to portray a patient case. In the future, we will train the standardized patients for assessing student performance and providing feedback on interpersonal skills, professionalism, as well as patient satisfaction. We will show you another 9 OSCE rooms on the 7th floor. All the OSCE rooms on this floor are equipped similarly to those on the 8th floor. This debriefing room provides opportunities for learners to explore and understand what happened during a training exercise, to discuss what went well, and to identify what could be done to improve their performance for next time. And this is a smaller storage room in our center, approximately 248 square feet. Our largest storage room is on the 9th floor, and we will also take a tour of this later. In this storage, we have 2 CardioSim 7 digital heart sound simulators, 4 eye and ear examination simulators, and 1 SAM. Now, we are going to the 9th floor to take a look at our simulation rooms. We have a total of 11 rooms on this floor, including 4 simulation, 2 control, 2 partial task, 1 preparation, 1 debriefing, and 1 storage room. Here is simulation room number 1. It is reserved for simulation activities performed on virtual reality simulators. At Cecics, advanced procedural simulation training on virtual reality simulators is reserved for postgraduate level trainees. In this simulation room, we have the following virtual reality simulators. One, CAE Lab VR. 2. CAE Cath Lab VR. 3. Realistic simulation in point-of-care ultrasound and echocardiography. 4. CAE Endo VR. 5. Harvey Mannequin Cardiopulmonary Simulator. And this is the control room where behind the one-way glass, our faculty educators, assessors, and simulation specialists will monitor and control the mannequin's responses according to the learner's interventions. Now, we're going to simulation room number 2, where we have installed 2 high-fidelity simulators. Our Lardo SimMum birthing simulator enables our students to practice obstetric skills individually or in small groups in a safe environment, while our Lardo Sim Junior allows for the diagnosis and the treatment of pediatric conditions. In this simulation room, we have the following virtual reality simulators and equipment: 1 Sim Mom, 2 Sim Juniors, 1 Nolo obstetric simulator, 1 crash cart. In this simulation room number 3, we have the following models and equipment: 2 HAL adult multi-purpose airway and CPR trainer, 2 SUSI S2000 advanced nursing care patient simulators, 1 crash cart. This simulation room can be set up according to the requested simulation scenario, whether it be a medical event in the emergency room or in the ICU. Simulation room number 4 is equipped with 2 Lardo Simmons, hospital beds, vital sign monitors, 1 HAL S3201 advanced tetherless patient simulator, and trolley for simulated medications. With the Lardo Simmon, a high-fidelity mannequin, we can set up a scenario of a patient with severe asthma attack and acute respiratory failure, or a scenario of a patient with cardiorespiratory arrest due to a heart attack. Medications used in all 4 simulation rooms are clearly labeled simulated medication and/or do not use for patient care, and simulation equipment or instrument are labeled simulation equipment and/or do not use for patient care. In summary, please review this slide for models and equipment in 4 of our simulation rooms. And this is our partial task trainer room, where our students can learn and develop skills in a safe environment before they perform on real-life patients. We can set up different types of clinical skills in this room, such as CPR or abdominal paracentesis technique, and etc. Next, we will take you to our largest storage space. It is a very important room in our center, with a total surface area of 732 square feet. Currently, our storage rooms are a bit small to accommodate movable carts and clinical equipment, as well as simulation supplies and mannequins. Therefore, we have maximized the use of our storage space with 5 shelves, and these shelves are organized based on particular skills. Here's a shelf for obstetrics and gynecology skills. And that is the shelf for internal medicine skills. We have many kinds of low, medium, and high fidelity models which are available for training. Please review the following slides for detail. This is the end of the tour to our Clinical Simulation Center. Thank you very much for watching our video, and we hope you have a nice day.